I would like to welcome all of you here, colleagues from Ministry of Health, all the different partners and the different individuals who have managed to spare time to be with us today for this national dialogue on eye health.
80% of the learning we do as human beings and as young people is often through the eye. Of course, with the exception of our colleagues who probably hear, feel, and probably touch. Eye health takes center stage.
I would like to appreciate all of you that have spared your very precious time to be a part of this very memorable event, where we are looking at a very clear future, but besides safeguarding our children is eye health in Uganda. And thank you very much, Light for the World, for giving me the opportunity to be mastering this event. This is a true definition of disability inclusion, where we say nothing about us without us. Ladies and gentlemen, make me your own starting today.
We are Light for the World, and our job is actually to spark lasting change for disability rights and eye health in sub-Saharan Africa. Why do we talk about disability rights? Because it's an entry point into inclusion in spaces such as health, education, and work as we know it. Can we put resources together, work together, and see that we can change? I think doing it on our own as Light for the World will not serve us any purposes. The needs are definitely immense, and we need collective action.
In fora like this, we would like to sensitize our people that sure, eye services are very, very close to them. The place where they go for their malaria treatment, the facilities where they go for immunization is the same facilities that they can get care for their eyes.
Austria has been a close partner to the government of Uganda since 1992. Together in a partnership, we have implemented a number of development programs. As Austria, we have two focus areas in Uganda, and that is access to justice, good governance, human rights on the one hand, but then also access to water and sanitation and environment on the other hand. I'm very honored, and as Austria, we are really very happy to be part of this journey of providing critical eye services to the children of Uganda.
A child born with a cataract operated early, before the age of 8 years, is condemned to lifelong blindness.
We have to realize that ophthalmology is not a cheap discipline. The equipments are expensive, and the consumables are also expensive.
For vision screening and diagnosis of infants and young children, you cannot do it alone as a healthcare worker. You cannot do it alone without the support of teachers. All these people will have to work together when it comes to identifying and screening the children.
Availability is actually the biggest problem in the provision of eye care in Uganda.
We need to do a little more in raising public awareness of the need for us to have this skill set acquired by many of us in this country. On behalf of the Ministry of Health, I sincerely thank you all, especially our partners that have been involved in delivering eye care services in Uganda to the benefit of the ordinary Ugandan. To the general public, I implore us all to always appreciate and protect the gift of sight, especially for children.